All right. Attendees are entering. Come on in. Hello, everyone. Good morning. Good afternoon. Not good morning. Good afternoon. We'll let everyone come on in before we get started. Welcome, welcome. Thanks for spending your afternoon with us. We got people joining, probably getting their audio put together. So we will give you a minute to get in. Excited to have you here. All right. Hey, everyone. I'm Lauralie Levy. I run the marketing here at SHIFTit Health. Good afternoon, and thanks for joining us. Looks like people have gotten in. That's great. We have a ton of great information to go over today. I can't wait to share it with you. So before we dive in, I'll introduce the team who's here with me, and even mention someone who's not with us, doing a little bit of SHIFTit work elsewhere. So our CEO is on here today, so you guys have direct access to hear from him. His name is Souheil Jawad, and he's going to talk today about how the platform is really built to give professionals, medical professionals, freedom and, what we can do to help facilities. David is here from customer service, and so he's going to talk to you guys today along with Rick, our CTO, be walking you through a live demo of SHIFTit, so you guys will be able to see what our platform actually looks like. What does it do, right? I'll show you behind the curtain a little. We got Kristen here. She's our senior recruiter, so she really helps onboard professionals. You guys want to know her if you're a medical professional and you're looking to pick up shifts. All right, she's going to answer some questions for you about that. And then Alize is here too. She is really one of our concierges, account manager, and she's doing the gift card drawing. So you guys want to pay attention to her too. Like I said, I'm Lauralie, and thanks for being here. So we're going to start off on why we're doing this. I'm going to take this part. Our co-founder, Dr. Z, she's doing her residency. We got a doctor on staff, and she came from this world of professionals. And so I'm gonna share with you some of the things I know about why she decided to co-found this company, and then we'll let Souheil talk a little bit too about why they came together to do this. She's really been involved, Dr. Z, in the healthcare industry, and what we've seen together are staff shortages, right? So you guys probably understand this wherever you are. If you're a facility, you're an HHA, it's so hard, right? But also on the other side, if you're a professional and you want to work, you just need some more flexibility. You don't have access to do that. Well, with SHIFTit, we want to change that. So staffing inefficiencies, right? They delay healthcare. It comes down to patients, right? And the patients need someone with them, right? I think that currently the system just isn't matching in a way that is really streamlining. And so SHIFTit is going to do that. We also know professionals, you want flexibility, right? How and when you work, you can't do all these 12-hour days, these rigid schedules, right? They're burning you out a little. We see that as a global trend. So if that sounds familiar to you, stick around because we're going to show how we're really going to solve it. So let me just say, one of the things we do is we connect professionals and facilities in real time. We remove the middlemen. So if you've worked with recruiters before on each side, we're really not a recruiter. We've got Kristen, she's going to help with onboarding, but the tech is doing that. It's helping to match you guys together and really getting your recruiters out of the way, which is great, simplifying the process, and we'll show you exactly how we're doing it. So you'll get to see all of that. All right, so this is a perfect time to join SHIFTit, whether you're a professional, whether you're a facility. Let's get started with Souheil, our CEO, on what we are doing instead of just why we're doing it. So Souheil, take it away.
Thank you, Lauralie, and thank you guys for joining. Well, let's talk about SHIFTit. SHIFTit Health actually does. Our platform was built to provide freedom, flexibility, control for both healthcare professionals and facilities. For professionals, we offer the ability to pick up shifts that fit their schedule. No more rigid hours or long hours, wait times. You have full control over when and where you want to work. And then for facilities, we offer a seamless, fast way to post shifts and fill them in real time. We would like to cut down on staffing gaps and ensure that you always have the coverage you need. We also integrated our AI-powered system, and that what it does, it basically matches professionals with the right shifts based on availability, location, expertise. This is not only to save you time, but also money. By reducing the reliance on staffing agencies, we basically would like to minimize that friction that agencies, recruiters, and the time that it takes to get somebody onboarded and to pick up a shift.
Perfect.
I'll
All right.
give it
So
back to Lauralie.
yeah, sure. Thank you, Souheil. All right, so now let's get into it. We're going to show you how easy it is to use the ProConnect platform. So this is for facilities and home health agencies. If you're like, okay, but how do I get shifts posted? How do I match with professionals? This is where you're going to see how we do it. So I'm going to let David, our account manager, and Rick, our CTO, walk you through how shifts get posted, how they look when they're accepted on your back end, and how to really manage the entire process. So check that out now. So why don't I turn it over to David and we'll get started.
Hi everyone, I'm David. We're gonna go ahead and start by showing you how to create a free account and how to post shifts. So we're gonna go ahead and create that account. We're gonna be entering all of the demo information on here. As you can see, you'll also be adding a logo of your company on here. So we're gonna go ahead and select that logo.
Remember, this is for facilities, HHA. This is where you go in the back end and you're going to get ready to get your shifts on here. So professionals, stay tuned. You guys are next.
Correct. And for this demo, we're gonna be selecting home health agency on here. All right, and you're gonna be filling out the information of whoever is posting these shifts or visits. Perfect. We're going to be filling out the address information on here. And we're going to be agreeing with the terms and policies. And then we're going to go ahead and create that account.
Not super cumbersome, right? Pretty streamlined so far.
Perfect, exactly. You're going to be rerouted to a third party page here where you're going to be submitting your payment information. And this payment information is going to be used to pay your shifters. All right. Oh, my screen went away there. Let me go ahead and share it back.
Yeah, and this is something, hey, you know, facilities, HHAs, if you guys are like, I'll do this later, you can do it later. So however you're currently paying your staff, you could just enter that information. You guys can actually use whatever payment method. Stripe integrates with a bunch. So if you want to use a bank account or credit card, I mean, we are accommodating. But if you're like, I'll skip it for now, I just want to get into the dashboard, here we go. You'll just need to do it before you actually post a shift and publish the shift. Okay, go ahead.
We're going to be starting by showing you how to post a visit. So for here, you're going to be selecting what facility you're putting that visit for. You're going to be selecting what type of professional you're looking for. So in this case, we're going to be choosing RN with experience of 3 to 5 years. And we're going to be doing a start of care as a service needed. You go ahead and select what date that service can be needed, and as well as the time. We're going to be selecting the rate that you're going to be paying that professional, and as well as the mileage. Here on the right side is where you're going to be filling in that patient information. So as you can see, you fill it out with the patient information.
So for home health, you guys probably realize, oh, you're putting in a patient's information, but our shifters, professionals, you guys won't see that until after the shift is accepted. So some of that, you'll just know it's in your area and you'll be matched because that's in your area, which is great.
Yes.
And then facilities can add notes here, which is wonderful too. It's what you will see if you're a professional and you're ready to pick up the shift. You'll be able to see a little bit of notes.
Yes. And something that we also want to point out here is that we know that sometimes clinical notes are not submitted in a timely manner. So that's why we have this invite shifters option here, where you can invite a specific shifter onto your shift. We're going to go ahead.
Yeah, so if you have a list, right, of your favorite home health aides, you can actually schedule them through this platform, which is great. So I want to point something out here, David, just really quick. So you guys will see that we have a platform fee. It's only 9%. And this is for the facilities, what they pay. You know, we understand recruiters can charge up to 200% of the shift cost. We don't do that. And today, we're actually going to, for anyone who signs up, any of these HHA facilities, if you guys want to try out our platform, we're going to waive that platform fee of 9%, and you don't have to worry about that. So, so just so you guys know, hey, we're being transparent. This is all it takes is the platform fee, right? And then you can post your shifts with us, and it's nominal compared to what we know is out there today. And hey, guess what? Your shifter, your professional is getting a preferred rate that you have set aside for them, which is wonderful. And hey, if you're a professional, you can say that rate really works for me. I'm going to accept that. That's great. And it leaves more room too for the facilities, right? And the HHAs to say, I can pay a little more because I'm not paying all of these fees. So
yes. Once your shift is posted, a notification gets out, sent out right away to any professionals around your area, and it starts the matching process. Awesome, thank you.
Great. And then Rick, let's show them around the dashboard a little bit more. So now you guys can see how a shift is posted. We'll show you what the Pro Connect tool looks like a little bit more for those that want to get granular. What else can you do back there? And then, hey, professionals, stick around because you'll see how it looks on the app. Go ahead,
Yep.
Rick.
Thanks, Lauralie. Yeah, so David showed how quick it was to post a shift. I'm going to go into some of the other features that are available. The first thing that when you sign in, you see is the dashboard. On the dashboard, we focus on those available shifts that are just posted that are waiting for shifters to accept. So you can see in my case, I have 2 shifts and 1 visit that are available. And if I want more details, I can actually go into the particular tab over here on the left and see more information. So as I go into shifts, I can see actually that there was 1 shift that was completed on 10/8. I can go to visits. I can see that 2 visits were completed both on 10/8 as well. And then I can see that there's 1 shift that has been accepted. And then that one that we saw on the dashboard as available is also here. We also have a messaging feature built into both the app for professionals and in here into Pro Connect. So if I click on messages, I had a shifter named Marilyn accept a shift. So she's saying, hey, I've got a question about the visit. I've responded back, yes, how can I help you? And then when we go over to the shifter side for the professionals, we'll see that side of the conversation as well. There's a few other tasks that you can perform in here. One was touched upon already, which is payment methods. That's Stripe. We've got contact us if you have questions. And then we have some video tutorials as well that we can show. And then there's a couple of account details here as well. So yeah, so those are some of the other features that are built into the app as well.
And what's great, I think, about the message center is that as soon as you accept a shift, it opens that up. So instead of really having questions and no one to ask and no contact, I mean, we're out of the way and letting you use the technology. If you're a professional, you can speak directly to that HHA and ask questions. If you're a facility or HHA, you can immediately say, hey, here's everything you know before you get here, next week. And so it's really done through the app, which is great. You don't have to rely on a third party in the way. Okay. That was a lot so far, a lot of talking, but you guys got to see a little bit of how we work behind the scenes. We're going to take a break to do a gift card drawing, just like we said we were going to do. We have lots of gift cards over here. The first one we're going to give away is $25 Amazon gift card, and I will let Alize do that drawing. Go for it.
Thanks, Lorelai. Now it's time for our first gift card drawing. All right. First, we're going to give away $25 to 1 lucky attendees. So the winner is Jean. Congratulations. Please send me a direct message with a good mailing address for you before the session ends. And don't worry if you didn't get one this time. We will have another drawing soon. Let's keep going. Christian, would you like to show the pros how to pick up those shifts?
Absolutely. Thank you, Alize. Rick, if you wouldn't mind sharing your screen.
Absolutely.
Thank you so much. So it really is a very streamlined process in selecting your shift. AI has already pulled the shifts that are available for you based on your location and your license. So you can see the location will be there, the license required, the date, the duration of the shift, and your start time and your specialty as well. So if it's something that's appealing to you and you'd like to pick up that shift, go ahead and select it.
Okay.
And then once you go in there, you can hit accept. It's that simple. If for any reason you need to cancel that shift, you can do that as well. If you have questions about that shift, Rick had showed that feature where we can message the facilities.
Right. So once you've accepted the shift, that opens up the chat ability here. And then I do want to mention one other thing here. It was something Lauralie touched on earlier, and that is for visits for patient confidentiality and privacy. We've got the visit details here. Before you accept the shift, what you can see is the city, state, and zip code. All right, Kristen.
Perfect. Okay, so let's show you guys now how to register for an account on the platform.
Oh, sorry, just one other thing I want to show real quick. My apologies. We also have a calendar feature built in here at the bottom, you can see. And what it's showing is both completed shifts that I've done, as well as shifts that are available, and then shifts that I've accepted. So you've got that feature. Now I'll switch over, Kristen, and show the registration process.
Thank you.
All right, so I've got the app here, just installed it, and I go to register, put in my info here.
Name, email address, and then you will receive a confirmation code by email. Once you receive that email or that confirmation code by email, go ahead and enter that.
Yep, let me get that code here. 679668.
Perfect.
All right.
Now we logged in. It's self-explanatory. Enter the information that it's asking for. And we're entering all this information because, like we showed, when you select a shift based on your location, it will allow you to, it'll extract all that information of where the closest shifts for you will be. So you'll select your specialty, what you're looking for your hourly rates, your years of experience. Make sure to enter in your professional license information. And make sure this is accurate, because once your account moves over to our onboarding and compliance department, they're going to need the accurate information in order to get your account verified.
Okay. Now, because this is a demo, this is just a sample photo, of course, but we ask that you use your real ID.
And then upload any certifications that you have, ACLS, BLS, any certs. Put in the expiration date as well, and take a photo of those.
Okay.
And it really is that simple. Once you've created your profile, it will move over to our compliance and onboarding department. They'll get you fully verified. If there's any issue with your account, if any certifications don't match up or anything's missing, they will send an email out with what is missing. And then once it is, your account is verified and approved, you'll be able to view shifts there.
Wonderful. Thank you, guys. We have some questions coming through the Q&A. We're going to save those just towards the end, but if you think about them, go ahead and send them. And then when we get to the end, we're going to answer them. So keep them coming. All right. So something I want to mention that we're not going to totally show a ton of right now, but we wanted to talk about is that SHIFTit also handles clinical rotation management and scheduling. So if you're on here and you're a hospital and you're a facility and you're like, oh, yeah, I accept clinical rotations, we can handle it for you. So David is your guy. He is the one who helps get the students on board. He background checks, we drug test. We make sure that the clinical rotations are scheduled for the 8 weeks. If that's how long, we sort of match the schools and the hospitals and the students, and we take care of all of that. So some of you on here have gone through those clinical rotations, and it'd be very nice to just see your schedule and know where you're going to go. And hey, if you already finished your rotations, come on board, pick up shifts with us, okay? So we can handle both those things. If you have questions, we'll give you guys the email to send to towards the end, so you don't forget. Oh, let me just, okay. All right. So now what we're gonna do is we are going to do another drawing. So everyone take a little breath. Alize, go for it.
All right, it's time for another $25 gift card giveaway. Let's see who our second winner is going to be. Perfect. Michael Richard, congratulations. To claim your prize, please send me a direct message with your mailing address and your contact information. Stay with us. We've got more surprises coming. Let's move on to hearing from our CEO about what special features we have that makes us different. Souheil, thanks so much for joining us today. Go ahead.
Thank you, Alize. Appreciate that. Let's talk about some of the exclusive features we're rolling out at SHIFTit Health. As David was showing you, we just recently launched the private shift, and we'll continue to work on that. So that way, it will give you access to shifts from your favorite hospital or home health agency, as well as hospice, but also expanding into our dental staffing, giving even more healthcare professionals access to flexible work. And we're working on our payroll to add to our platform in addition to what we currently have, to just help streamline or to ensure smooth, fast payments for professionals. All these features are part of our commitment of improving the healthcare staffing experience. And I guess I'll give this back to Lauralie to talk more about our offers.
Great, thank you. All right, so like we've talked about, we're waiving that platform fee if you're a facility or HHA, so you do not have to pay it. We're going to give you up to at least 10 shifts, okay, for you to try us and for those shifts to go fulfilled, and for you to give our platform a try without anything. So I know recruiters don't ever do this, and we just want to show you this tech. It's really good. You could see how streamlined it is. You could see how easy it is on both sides, right? Our professionals are going in, they're uploading everything. It took minutes for us to do that. So as long as you go find those certificates, and you have your licenses handy, you can be working, you know, as soon as we verify you, which could be 72 hours. And on the facility and HHA side, we know you guys need people and you need them fast. We know startup care turnaround is very fast. So we will help with that concierge white glove service to make sure we can find you someone and get you staffed quick. So give us a try, add us to the mix of what you're already doing. There's really no risk at all to do that. So super excited to share what we are doing with you guys and excited to let you try us for free. We do have some time. So I'm going to get into some of this Q&A. We have some great questions coming through. And just for our winners so far, you guys, I just want to tell you, I have your emails. So if you're having trouble either sending a DM, we're going to get you your gift cards. Don't you worry, we're going to email you. So, all right, so I'm going to start with Q&A. We got some great stuff coming through. So first one, and I'm going to give this one over to our CTO, Rick. So is there a maximum amount of shifts that can be done daily is the question. So that came from Cassandra. She wanted to know, is there a maximum number? So that's a great question. Rick, do you want to take that one?
So there's sort of two answers to it. And Souheil, I don't know if you want to jump in. There are some restrictions built into the platform in terms of back-to-back shifts to allow travel time between shifts or visits. So that is one thing that is a restriction in the system. I don't know. I don't want to speak to any like the HR or California laws or regulations. So Souheil, if you want to maybe chime in on some of those.
No, I think you're correct. That's
Okay.
That's basically it.
Okay.
Yeah, that's great. And another one came through. We answered it, but let's give that to everyone. So this is a great one from Catherine. Can a shift be canceled due to unforeseen circumstances? Souheil?
Yes.
Yeah, short answer is yes. So, you know, it's not something we want to promote all the time, but if that happens, that's fine. In fact, on the facility side, they'll see that it was canceled, and then it can easily be reposted. So these things happen. We totally understand. We do have a policy so that it's not happening all of the time. If it happens in excess, then, you know, we'll have to work with you to sort of restore your account if there's something crazy that's going on. But yes, we totally understand that that can happen. So yeah, no big deal. Okay. I'm going to wait to see if a couple more are coming through. Okay. Okay, so I have another one. So what if I'm outside of California? Okay, so this is a great question. So we have launched in California. So if you're outside of California and you're a professional, we have not yet launched in other states. So we are still working on that. So stay tuned. You're not the only one outside of California that wants to work with SHIFTit. And as we start to roll this out across the country, you will be the first to know. So stay tuned. You know, you'll get an email. Say you try to sign up on the app, you'll get an email that tells you, hey, we're not in your area yet. And you know, we hope to be there. So stay tuned. I know you're excited. We are too. Okay, so that one just came through. All right, let's see. Okay, so how does SHIFTit Health handle payments and payroll? So that's what's great is that everything is really in the app, right? You guys saw that our facilities and HHAs, they're uploading payment information, right? And then you're uploading your banking information too. So that payments can go directly, you know, that you're getting paid if you're a professional. And then on the facility side, since you're hooking everything up, what's great is that your payments are coming out. You don't have to think twice about it. It's hooked up to your payment method, to your bank account. And so we're really handling all of that as SHIFTit in the middle. So you just make sure everyone's accounts are set up, their banking accounts, and then SHIFTit takes care of all of that so that payments that are made by the facility are getting to the professional. And like we said earlier, we're not even charging fees right now in the beginning, platform fees for the facilities and HHAs. So good question. Money's getting to your guys' account. We try to make it very streamlined. Okay, this is a great one. What makes SHIFTit Health different from traditional staffing agencies? We got to let Souheil take this one because he's worked alongside of them a lot. So what makes us different, Souheil?
Absolutely. Well, the first thing that I would like to talk about is if you're a healthcare professional, you're not going through that friction of healthcare, dealing with recruiters, dealing with the staffing agencies, getting a rate and then getting paid a different rate. With SHIFTit, it allows the healthcare facilities, HHAs, home health agencies, hospice, and let's refer to them as facilities, so they can maintain their budget. If their budget for an RN or for a shift is $150, they can go ahead and post that. And then it's also up to the healthcare professional to accept that because they see it direct. We only charge a platform fee. And then you also get to pick if you want to be on the payroll or not. So if you're on the payroll, it's also the same thing. Our strategy is really you get to accept the visits based on what the facility posts. And that's what makes us different. We believe in transparency. You're going to find everything at the fingertips at your fingertips. You see the rate, you know who you're working with, you know who you're dealing with, you know where you're working. So that way, we want it to live in the background so we can increase the demand and increase the hours available to healthcare professionals to be able to fill shifts.
Perfect. Thank you. Yeah, I think that's what's great too, is that you can see what's been posted, right? You can see how much is this shift going for and does that work for me? And if it doesn't, you keep moving. And if you're like, yeah, that totally works, I'll accept it. So, you're basically setting your own rate, which is wonderful. If there's something that's right in your neighborhood that you feel like you can get an extra shift, please, right? We love that. If you're an RN and you haven't worked home health, you can find those shifts here too, and maybe open up that opportunity for you to work in another expertise that maybe you haven't done so much of, right? And then it'll just be a matter of years requested and all of that. So we are moving along. We are going to give you guys some time back. I have a couple more questions. So here's what we got. Can professionals pick up shifts that fit their specific expertise or certifications? Yes. That is the point, right? So we're matching you. So what you're seeing is really for you based on availability, location, expertise. And so when you set up your profile, you put all of that in. And then what you see is really what's for you. And if you're not seeing a lot, then there may be some things that maybe there's shifts that are too far from you that are posted. So get everything in there, put your address so that we can really use your location. For the facilities and the HHAs, putting things in, right? For a facility, it's going to be, is it near you? And then for HHAs, right, you have even more opportunities because you're putting the location of the patient. So that's going to match the professional. So that's a great one too. Yes, pick up shifts that really fit your expertise. All right, we have time if we want to do another question or not. Otherwise, we can give you guys some time back. I'm just going to check Q&A one more time. Everything looks good. Okay, congratulations to Faye and Michael. We are going to send you guys your gift cards. For everyone else, remember this, help at SHIFTitHealth.com. If you need anything, many of us are on that email, whether it's a tech question, a marketing question, whether you're a professional having a problem with the tech, whether you're an HHA or facility that wants to get signed up, but maybe you were confused about something, anything, you can reach us there, help at SHIFTitHealth.com. It's been so awesome to show you guys what we have going on and take a little bit of your afternoon. We appreciate you showing up. We're excited for those winners and really excited to see you guys try our platform for free. If you have anything that you need from us, you know how to find us now. And we are just really excited. Thank you so much. And we will give you some of your day back. Bye, everyone.